I believe very much in just going, meeting, telling your story. Sometimes you succeed, sometimes the door is shut in your face, but you've said your story. Talk to them and actually remind them that, yes, you've been investing in tobacco. It has been like the default option. Everybody's forgotten about it. It's like on automatic mode. And really opening their eyes that now, you know, that they are on the wrong side of history and that they can do something about it.
Bronwyn, Denis, thank you very much for joining us this afternoon. Bronwyn, I'm going to start with you. You've been very involved in pushing the finance industry to move away from tobacco stocks. Just tell us all about how it began and where you are now.
Well, in a nutshell, it began because my very early experiences as a doctor in Melbourne, Australia, were seeing the devastating impact of tobacco on individuals. And those early experiences I really carried with me for my whole life. 10 years later, I was a qualified oncologist working in Melbourne, and I found out by accident, completely by chance, that my compulsory pension fund was investing some of my money in the tobacco industry. And for me, it just made absolutely no sense to be working so hard to try to help the victims of tobacco, but in fact to be making money from the industry at the same time. So since that time, I have been engaging with finance leaders, first in Australia and now all across the world, to ask them to learn a bit more about tobacco, to reconsider commercial relationships with the tobacco industry, and to perhaps stop investing, stop lending, and stop trying to profit from this industry that causes so much harm.
Denis, AXA was the, I believe, first financial institution to divest from tobacco stocks. Tell us how that began.
Well, that began because I was called by a leader of a financial services firm in Australia who knew Bronwyn, and he asked me to meet with her. And I met with Bronwyn, and she made the case that being a big global insurer, especially involved in health insurance, it didn't make sense for us to invest in tobacco stocks and tobacco bonds. And that resonated with us because we are a firm that is very engaged in social responsibility topics, and including social responsibility investing. In 2015, we divested from coal-related assets, and in 2016, we were convinced that we should not only divest from the tobacco industry, but also stop insuring the tobacco industry.
And what's the ripple effect been like? What other big institutions are buying into it, if any?
Bronwyn asked me to also organize contacts with other financial services firms across France, and that was a good story because we managed together to convince a number of the French leading institutions, SCOR, Natixis, and then BNP Paribas to also do the same. And we are starting to build a coalition, which I believe is important to succeed.
And it's important to say it's just starting. So there's a long way to go, but it's amazing to have finance leaders like Denis standing beside us in the health sector and really committed to advancing this work, not just in France and not just in Australia, but all across the world.
What are some of the big challenges, Bronwyn, that you've come across in engaging the financial sector?
I think the biggest challenge is that all the different sectors of society are living in silos. And that became very apparent very quickly. We've got the whole global health sector working very hard to try to control tobacco. We have doctors and nurses in every country on earth, but 7 million people will die this year as a result of tobacco. So those efforts are important, but it's not enough. We've also got the government sector. 181 governments have signed up and ratified the Framework Convention on Tobacco Control, but that too isn't enough. If the global finance sector just continues business as usual and continues to lend money to tobacco companies and invest in tobacco companies, we're working against each other.
Denis, final question. What message is it sending to the public and to governments, more importantly, by not investing in tobacco?
I think the message is quite simple. Tobacco is really different because the first cigarette is already doing harm to you. So it's probably among the exclusions in terms of investment that you can decide. Tobacco is the easiest one, and it has a very long-term effect. So I think if you want to be consistent, if you want to invest in a socially responsible way, getting out of tobacco should be an easy decision.
Okay, Denis, Bronwyn, thank you very much for your time. Enjoy the rest of the conference.
Thank you.
Thank you.